Hello, I'm Dr. Rajat Gupta, a board certified plastic surgeon working in Delhi. And today I'll be talking to you about chin enhancement surgery, or also called as genioplasty. The first question you will ask is, how do I know if I need a chin augmentation? It's easy. Understanding facial symmetry is very easy. What you need to do is follow what I'm saying. Take out your thumb and index finger and hold them like this and measure the distance between your forehead, the root of the nose to the lips, and the lips to the chin. Now, once you do that, if you see that the thumb is not meeting the chin, that means your chin is smaller. In other words, face is actually divided into equal thirds from the upper part of forehead to the nose root of the nose to the lips, and from the lips to the chin. This tells us whether your face is symmetrical or not. If your thumb is not meeting the chin, your chin is small. That is a retruded or a small chin. The other way is to see your picture on your profile view, draw a line perpendicular from the lip, as I'll show you in the diagram. If the line does not meet the chin, or the chin is more than 2 millimeters behind this line, that means you have a recessed chin or a retruded chin, and hence you need a chin augmentation. So your chin can be small in two dimensions, either in a vertical dimension or a horizontal dimension. In any of these cases, you need chin augmentation procedure. So what is genioplasty? How do we do genioplasty? What are the results of genioplasty? What is the recovery time? With this video, you will get a complete idea of what a procedure entails, so that you don't have to play blind with your surgery. Your results and your expectations should be made clear. So first, let's see what genioplasty is. Genioplasty is an entirely safe cosmetic procedure in which we either use fillers or implants to bring out the shape of your chin. Depending upon your current chin and the aesthetic needs and your goals of your aesthetic requirements, we can decide to go for either a small sharp chin or a masculine broad chin. We can use either fillers like hyaluronic acid or implants. Implants are in fact of two types depending upon what shape you want, either an anatomical or a U-shaped implant. Or there are also some customized implants which we can do for certain kind of patients for their chin augmentation. These different shapes of implants give a different kind of results in every individual. To get a much more broader shape, you use anatomical implants. To give a much more sharper shape, we use crescent shape implants or U-shape implants. Now let me tell you how we use these implants. We need to put these implants on the bone in a particular patient. Now, there are two ways how you can go in behind the skin on the bone and fix the implant. Either you can make an incision outside or you can make it inside. I usually prefer to make an incision inside the mouth so that there is no scar visible at all throughout your life. Make an incision inside the mouth in the buccal sulcus. Make a pocket on the bone and fix these implants on the bone so that they are fixed robustly, they don't move, they give the shape you want. And the sutures are used to close the incision inside the mouth. These sutures are absorbable, so nothing needs to be removed. It's daycare surgery. One can go back the same day, eat or drink anything from the same day evening. Just make sure that every time you eat or drink, use a Listerine mouthwash or any chlorhexidine mouthwash to just gargle it so that you don't have any infection. It's a painless surgery. You have no pain, no discomfort. It's a very, very rewarding and you see the result immediately. So the advantage of using an oral incision is there is no scarring outside the face, outside on the neck. The implant pocket is made precise by an inside intraoral technique. This technique significantly reduces the trauma and hence fastens the recovery time. This is very, very important because in modern day world, most of my patients want to go back to their daily routine as fast as possible. As I said, it's a daycare surgery. One can go back home the same day. The recovery process is very smooth and very fast, and it's super easy. The other way to achieve a chin augmentation is by fillers. Now, what are fillers? Fillers are hyaluronic acid molecules which comes in a packet or a syringe, and we can inject the syringe on the bone into the chin to shape your chin in the desired shape you want. The advantage of this technique is the procedure takes 10 minutes, immediate result, no surgery, no sutures. But the drawback is this is not permanent. Implants are permanent. Fillers last something around 10 to 12 months depending upon what fillers we use. Having said that, each of these procedures have their own sets of advantages and disadvantages. I would recommend that you should meet a board certified plastic surgeon and then decide which procedure you should go for. Before I go, let me show you a couple of my results so that you understand what impact a genioplasty can make to your face. As usual, if you have any more questions, please write to us and I'll be happy to answer you. Like, share and subscribe our channel to get more informative videos and regular updates about what we do and how we do. Thank you.